Carmen here. I am a myofunctional therapist and I practice solely online and I educate a lot. So I like to call myself your myofunctional educator extraordinaire. And today in this Myo Minute, we're going to be talking about, do I have a tongue tie? This is a question that I get a lot. And while the tongue tie is important, it is not the biggest thing to worry about. Whether you have myofunctional impairment is much more important. That is a much bigger picture of wellness. So I compare it to a car that's running on 8 cylinders or a car that's just limping along on 2 cylinders. If you have myofunctional impairment, that is more concerning than just having a tongue tie, okay? The tie is a physical barrier that affects function, and it certainly is a concern, but many people focus solely on this question, do I have a tongue tie? Let's talk about why it matters. So people will say, okay, so if I have a tongue tie, why does it matter? And really, I like to give this answer based upon age. So if you are the parent of a child with a tongue tie, it matters, okay? The child doesn't have a dog in the fight, and so you as a parent, it's up to you to learn and understand and advocate for your child. I have had many parents that have significantly tied children. I mean significantly. And the parents will say, well, my child is just fine. But that's only because you don't know what's broken. So you don't know what the concerns are. So on top of that, the craniofacial changes that result because of a tie should make parents want to get it fixed. So you don't know what's broken, and it is up to you to get this information on what you should do about it. So I know as parents, it is our job to protect our babies, and we don't want to inflict any pain on them. Okay, I get that. But thinking about the impact of a tongue tie is very important. So I know that you think Johnny's lisp is cute, or that we as parents are taught to accept our children as they are. And of course we do, right? We're not here to pick them apart. But it is a big deal, and it's important for you to understand, because you choosing not to inflict pain on Johnny today to have a frenectomy done is you choosing down the road that his jaw and face may not develop properly. It's you choosing that his airway may not develop properly. And it's you choosing whether he has crowded, misaligned teeth or not. So that's my spiel about kiddos. Now, if you're an adult, you may have adapted well. So you might say, well, Carmen, I'm fine. I don't really have a lot of issues. And so it's not about appearance, it's about function. So if you're trying to figure out if you need to do something about your tongue tie, then I tell you, you know what? There's not a cut and dry answer, because some people compensate better than others. And if you look down the road into the future, you might start to have problems as you get older. So we see symptoms start to get worse as you get older. A great example is I have recently had a real big influx of older clients who are now suddenly having trouble with choking. We dig a little bit deeper, we find out that these clients have tongue ties, and they really wish that somebody had known about tongue ties and had been providing education in myofunctional therapy, a long time ago. So I get a lot of people that say, I'm fine, I don't really have any problems. And that is because you're compensating well. And that's great. But what's going to happen in the future? That's the biggest thing to consider. So where do you turn? I would recommend that you do 3 things if you're wondering about a tie. First, I want you to educate yourself. Second, I want you to identify your impairment, okay? Now, this will happen with a professional, but if you're curious, at the bottom of this page, you can get yourself a free copy of my assessment forms that I use. And then the third thing I want you to do is I want you to stick with one professional to help guide you. This is very important because there's a lot of opinions out there, and sometimes those opinions, while they are not meant to be misleading or harmful, sometimes those opinions come from somebody who does not have the expertise or the background to be able to give great advice. So if you partner with somebody who can advocate for you, you are going to be in good hands, okay? Another question I get is, when should you worry? So I think I've talked a little bit about that with children. Again, my answer here is age related. I want you to be advocating for your child. You are the parent, and I want you to learn and understand and take the steps to help your child develop the best that they can and prevent things down the road as swallowing issues, relapsed ortho, maybe speech problems. You know, there's a lot of things down the road that if you choose not to treat your child today, you might be signing them up for down in the future. So how to get started, okay? This is the biggie. So I want you to find yourself a myofunctional educator extraordinaire. It doesn't have to be me, it just needs to be somebody. Now, in my weekly Facebook Live that I do live today, I will be sharing some of the myofunctional assessments that I use when I evaluate tongue ties. So if you want some more education, you want some help, you can catch me live today over on my Facebook page at The Tongue Trainer, and I will be there at 11:30 Mountain Standard Time, okay? Last, get my freebie. It should be in your email. Take the time to make sure you get the tool. Look at your myofunctional impairment. Assess yourself. See if you need help, okay? Remember, I am here for you, and I will see you in the next Myo Minute.